This video is going to talk about mental health. What is mental health? The capacity to live a full, productive life, as well as the flexibility to deal with ups and downs. In children and young people, it is especially about the capacity to learn, enjoy friendship, to meet challenges, to develop talents and capabilities. The terms mental illness and addiction refers to a wide range of disorders that affect mood, thinking, and behavior. Examples include depression, anxiety disorders, and schizophrenia. As well as substance use disorders and problem gambling, mental illness and addiction can be associated with distress and/or impairment of functioning. Symptoms vary from mild to severe. With appropriate treatment and support, most people will recover. About prevalence of mental disorders, charts 1, 2, and 3 respectively illustrate annual prevalence of Quebec of all diagnosed mental disorders, of anxiety depression disorders, and of schizophrenic disorders by age and sex for the period from 1999 to 2000 to 1999 to 2010. On average, mental disorders affects 12% of the population annually, which represents 903,000 people in 2009 to 2010. Anxiodepressive disorder accounts for almost 65% of all mental disorders, affecting about 7.5% of the population, or 581,000 individuals. Schizophrenic disorder affects 0.4% of the population, or 34,000 Quebecers. Diagnosed mental disorders, especially anxiodepressive disorders, are more prevalent in women than in men. Generally, schizophrenia appears in early adulthood in men and slightly later in women. By comparison, anxiodepression disorders begins during childhood and adolescence in both sexes. Prevalence of anxio from depressive and schizophrenic disorders varied little from 1999 to 2000 to 2009 to 2010. In people under age 20, the prevalence of mental disorders has doubled. Analyses have shown that this significant increase in the prevalence of mental disorders over the past decade can essentially be explained by more frequently diagnosis of hyperkinetic disorder. Chart 4 confirms the increase in annual prevalence of hyperkinetic disorder in Quebec boys and girls under age 20 over the past several years. Prevalence mental health snapshot. 450 million people worldwide are affected by mental, neurological, or behavioral problems at any time. About 873,000 people die by suicide every year. About 4,000 Canadians per year die by suicide, an average of almost 11 suicides a day. It affects people of all ages and backgrounds. On a per capita basis, suicide rates in Canada are on a downward trend. They peaked in 1983 at 15.1 deaths per 100,000 people, compared to 11 per 1,100 people in 2016, the latest year for which these data are available. In Ontario, about 2% of adults and 14% of high school students report having seriously contemplated suicide in past year. Four percent of high school students report having attempted suicide. More than 75% of suicides involve men, but women attempt suicide 3 to 4 times more often. More than half of suicides involve people aged 45 or older. In 2016, suicides accounted for 19% of deaths among youths aged 10 to 14, 29% among youths aged 15 to 19, and 23% among youth adults aged 20 to 24. After accidents, it's the second leading cause of death for people aged 15 to 24. First Nations youth die by suicide about 5 to 6 times, more often than non-Aboriginal youth. Suicide rates for Inuit youth are among the highest in the world, at 11 times the nation average. When people have mental health issues, who can they turn to? There are lots of options for support out there, although you might find some are more suitable for you or more easily available. There's no wrong order to try things in. Different things work for different people at different times. First, your doctor. For many of us, our local GP practice is the first place we go when we are unwell. Your doctor is there to help you with your mental health as well as your physical health. They could make diagnoses, offer you support and treatments, such as taking therapies and medicines, refer you to a mental health specialist, such as psychologist, recommend local support options. Second, a trained therapist. Trained therapists and counselors provide a range of different therapies through the NHS, for which your doctor could refer you, known as secondary care. In some cases, you might be able to contact them directly. Third, friends, family, careers, and neighbors. Sometimes it can help to talk to someone you trust about how you are feeling. They could help you to find information, discuss your options with you, come with you to appointments, help out with everyday tasks, giving encouragement and support. Fourth, charity and third section organizations. There are many national and local charities which offer various support services, such as helplines and listening services, information and signposting. Other services such as peer support, talking therapies, advocacy, crisis care, employment and housing support. Number 5, peer support. Peer support brings together people with similar experience. Your peers can support you and listen to how you are feeling, offer empathy and understanding, share experiences, information, suggestions for self-care and support options. 6. Student service. Higher education institutions usually have a student well-being center where enrolled students can go to for support. 7. Communities support services. If your mental health problems are severe or longer lasting, your doctor can put you in touch with specialist mental health services. This might include Community Mental Health Team, CMHTS, social care services, residential care services, and crisis resolution and home treatment teams, CRHS or crisis teams. Number 9. Workplace support. Some workplaces offer free access to support services, such as talking therapies. This is called an employee assistance program.